just numbers. These are people's grandparents, parents, and loved ones. We all have our own reasons, our own loved ones that we want to look out for and protect. I just got news last night that my godfather and uncle, Tom Walker, had to be readmitted to hospital last night. He's been in and out of hospital over a while, and I'm sending him my love. And we're all thinking about our loved ones who we haven't been able to see for many months, who we're worried about. We all have our reasons to keep each other safe, to follow public health advice. We need to do that. It's particularly nice outside in many parts of the country this week, which means we're still enjoying lots of fresh air. But winter is coming, and that means we're going to have to get into more enclosed spaces. We're not going to be able to open windows wide in rooms. Ventilation is going to become much more important. We need to remember to be careful. There is increasing evidence that aerosol spread is a vector of transmission. We need to wear masks. We need to avoid crowded, closed spaces, as Dr. Tam has said many times. We need to make sure we're making it into winter on a good footing so we can hold on through winter. The vaccines hopefully will be here in the spring, but there's a lot of work to do between now and then to make sure that we're keeping Canadians safe and healthy. That's the work we need to continue to be determined to do. We need to continue to be there for each other. So continue to follow local public health guidelines. Wear a mask, keep your distance, and download the COVID-19 app. Les cas de COVID-19 continuent d'augmenter au Canada et à travers le monde. Je veux être bien clair, la situation est sérieuse. Ce n'est pas le temps de baisser notre garde. Cette semaine, on a vu des nombres records de nouveaux cas dans plusieurs régions du pays. Hier seulement, le Québec a enregistré 1138 cas supplémentaires. Pensez à vos grands-parents, à vos proches, aux travailleurs de première ligne et aux plus vulnérables. Ensemble, on peut aider à les protéger en suivant les consignes des autorités locales de santé publique. Continuons de porter le masque, de garder nos distances et de télécharger l'application gratuite Alerte COVID. Il fait beau dehors ces jours-ci dans beaucoup de parties du pays. Nous pouvons continuer d'être dehors, mais dans quelques semaines, l'hiver va arriver. Nous allons devoir être plus à l'intérieur, dans des endroits moins bien ventilés, dans des endroits où on ne peut pas ouvrir les fenêtres. Et nous allons devoir faire vraiment attention, de faire tout ce qu'on peut maintenant pour empêcher les éclosions de la COVID-19, pour entrer en hiver dans une meilleure posture que ce qu'on est maintenant, pour pouvoir passer à travers l'hiver en sachant que le printemps va être mieux, l'été va être mieux, on l'espère avec des vaccins. Donc, continuons de tenir bon, d'être là les uns pour les autres. On a tous nos raisons de suivre les instructions des autorités de santé publique. Nous devons, tous et chacun, de continuer de faire notre part. De notre côté, le gouvernement aussi poursuit ses efforts. Par exemple, lors de la dernière semaine seulement, nous avons envoyé 3,5 millions de gants en nitrile vers les provinces et les territoires pour les soutenir dans la lutte contre le virus. Nous continuons aussi de distribuer des tests de dépistage rapides. Dans les 3 dernières semaines, plus de 2,8 millions de tests rapides ont été distribués et plusieurs autres suivront sous peu. While our government is doing everything we can to keep Canadians safe, we're also working hard to keep Canadian jobs. This morning, we received the news that 84,000 jobs were added to the economy in October, mostly full-time positions. This means over 2.3 million Canadians have returned to work after they lost their jobs during the pandemic. We're making progress, but there's still much more work to be done. The technology and innovation sector is and will continue to be a key tool in creating good jobs and rebuilding a stronger, more competitive economy. In April, we created the Innovation Assistance Program with the National Research Council of Canada to support innovative businesses, including pre-revenue firms that were not eligible for the wage subsidy. This investment helped small and medium-sized Canadian businesses keep 24,000 employees on the payroll. To continue supporting these companies and the people they employ, I can announce that we are extending the Innovation Assistance Program with a new investment of $155 million. High-potential, innovative firms are key drivers of economic growth, and we will be there to help them bridge to the other side of this crisis. Aujourd'hui, j'annonce un investissement de 155 millions de dollars pour prolonger le programme d'aide à l'innovation du Conseil national de recherche du Canada. Ce programme a pour but de soutenir les petites et moyennes entreprises du secteur de l'innovation, incluant les entreprises à revenus subséquents qui ne sont pas éligibles à la subvention salariale. Suite à sa création en avril, le programme d'aide à l'innovation a permis de conserver 24 000 emplois. L'industrie de l'innovation a un rôle primordial à jouer dans notre relance en vue d'une économie plus forte et plus compétitive. Notre gouvernement est là pour aider ces entreprises et leurs travailleurs à passer à travers cette crise. Le ministre Baines va élaborer davantage dans quelques instants, mais avant, j'aimerais aussi parler de nos efforts pour encourager la recherche scientifique partout au Canada. La science est notre plus grand atout pour lutter contre le virus. C'est pourquoi nos chercheurs doivent avoir accès aux ressources nécessaires pour bien faire leur travail. Par le biais du Fonds des occasions exceptionnelles COVID-19 de la Fondation canadienne pour l'innovation, nous ferons un investissement de près de 28 millions de dollars qui soutiendra 79 projets de recherche liés à la pandémie. Pour une équipe du Cégep André-Laurendeau, par exemple, ces fonds permettront d'étudier des endroits publics en se servant de la technologie 3D pour aider à améliorer les mesures de distanciation sociale. À l'Université de Calgary, d'autres chercheurs vont pouvoir se servir d'un nouveau microscope à la fine pointe pour étudier l'effet de la COVID-19 sur les vaisseaux sanguins. Les équipes sélectionnées œuvrent dans des universités, des cégeps, des hôpitaux de recherche, des collèges et des polytechniques à travers le pays. Ces investissements les aideront à se procurer l'équipement nécessaire pour bien mener leur recherche et faire avancer la science. As we head into the weekend, I want to end today by coming back to something I mentioned last Friday. Things are tough, and we all need to take care not just of loved ones, friends, and neighbors, but of ourselves, too. In many parts of the country, right now you might be asked to stay home and limit the number of people you see as much as possible. I know we all miss getting together with friends, colleagues, and extended family. It's not easy. So if you're feeling anxious, or if you're struggling with mental health or other challenges, pick up the phone and reach out to someone you can trust. You can also always call 211, a 24-hour helpline that will connect you to the right resources. It's free and confidential, and they can help you in more than 150 different languages. Merci. Prenez soin de vous. Passez une bonne fin de semaine.
Thank you. Take
Une
care of
bonne semaine du
yourself.
souvenir.
Have a good weekend.
Et je maintenant cède la parole au ministre Baines.
Nice to have a good
Merci.
Veterans Week. Mr. Baines, Minister Baines.
Thank you very much, Prime Minister. Since the early days of the global pandemic, companies have been stepping up to lend a hand wherever possible, and the Prime Minister has highlighted that often. And I've been consistently impressed with the enthusiasm and capacity of Canada's innovators to rise to the challenges that we face as a nation. Et le gouvernement travaille pour soutenir les entreprises canadiennes pendant la crise en cours. And at the same time, as a government, we've been working hard to support Canadian businesses during this time of crisis. Our government has already brought forward measures like the Canada Emergency Wage Subsidy to keep people working. We're helping businesses that are facing cash flow problems with the Canada Emergency Business Account. And we introduced the Canada Emergency Rent Subsidy to help with one of the biggest costs faced by small and medium-sized enterprises. And I participated in the debate last night where we're working hard to advance these very important measures so we can implement them and that these businesses can receive these supports. And today, we're announcing, as the Prime Minister has indicated, through the Innovation Assistance Program, a support measure that will inject $155 million to help protect Canada's highly skilled innovators. It's about keeping Canadian talent here in Canada. It's about investing in our number one resource. Since we first announced this program in April, the Innovation Assistance Program has helped over 2,000 companies, but also, again, as mentioned by the Prime Minister, support more than 24,000 jobs. Ces petites et moyennes entreprises innovatrices sont des moteurs de
These
croissance à
innovative
long
small and
terme
medium businesses
et de
are the
création
driving
d'emplois
force
de
behind
qualité,
long-term
surtout au Canada, un pays où
and
la science et
high-quality
l'innovation
jobs.
sont des atouts.
Jobs. This is especially the case in Canada, where
When we
innovation
support
science are
our most
assets.
promising early stage firms, we not only protect the next generation of Canadian entrepreneurs, but we also employ the necessary resources to make sure they can succeed. And we help ensure that innovative Canadian technology and research stays in Canada. So today, we're also providing new funding for equipment and tools to ensure our researchers have the support necessary to do their jobs, especially in trying times. The $28 million in research infrastructure support adds on to the significant investments that we have made. And through the Canada Foundation for Innovation's Exceptional Opportunities Fund, we'll cover urgent need for equipment for ongoing research related to COVID-19. And this funding will go to support 79 different projects at 52 universities and research hospitals, colleges, polytechnics, and CEGEPs across Canada. So it's incredible to see that entire network engaged. There was one project that I want to highlight, the one by Dr. Mary DeMarco and her team at the University of British Columbia, that is researching how COVID-19 damages the human's lungs and heart tissue. They're examining how the virus genetic code will affect the severity of the disease. And they're developing new innovative diagnostic tools that will easily detect the virus. So all of this is important to support science, research, and innovation. And this will help us build back better. And now I'd like to pass it on to Dr. Tam. Thank you.
Bonjour and bon après-midi à toutes et à tous.
Hi and good afternoon,
There have been
everyone.
251,338 cases of COVID-19 in Canada, including 10,381 deaths. Nationally, there are close to 33,000 active cases across the country. Over the past week, labs across Canada have tested an average of close to 61,000 people daily, with 4.7% testing positive. The average case count is now over 3,350 cases reported daily over the last 7 days. There are also increased numbers of people experiencing severe illness. Over the past 7 days, there were on average 1,200 individuals with COVID-19 being treated in Canadian hospitals, including 225 in critical care, and an average of 44 deaths were reported each day. As I mentioned earlier this week, I am cautiously optimistic that safe and effective COVID-19 vaccines will be available in the first quarter of 2021, bringing us one step closer to the widespread and long-term management of COVID-19. I would like to emphasize that when vaccines become available, there will be a limited supply at first. While that supply will continue to increase over time, it does mean that federal, provincial, and territorial governments will have to make important decisions on how to use the initial vaccine supply. The National Advisory Committee on Immunization, or NACI, is a long-standing expert advisory group that provides independent guidance and recommendations to inform these kinds of tough decisions. On Tuesday, NACI provided preliminary guidance on the key populations that should be considered for early COVID-19 immunizations, including people at high risk of severe outcomes or those at high risk of spreading to them, workers essential to maintaining the COVID-19 response or other essential services for the functioning of society, and people whose living or working conditions put them at elevated risk of infection and its disproportionate consequences, including Indigenous communities. The full guidance is available at canada.ca. While this preliminary guidance is helpful for planning, there is still a long road ahead. Clinical trials need to continue. Health Canada still needs to approve the vaccines if they are deemed safe and effective. and we will be receiving additional advice on prioritization based on the characteristics of each vaccine once approved. In the meantime, it is crucial that we continue to layer on individual protections that we know to be effective in keeping infection rates low. Stay home if you have symptoms, even mild ones. Wash your hands frequently, maintain physical distancing, wear a mask when spending time indoors with people from outside your immediate household, and avoid or limit time spent in closed spaces, crowded places, and close contact situations where you can't consistently maintain physical distancing, what we've been calling the 3 Cs. I remain committed to keeping Canadians informed and to share new information as they become available. Thank you.
Bonjour à toutes et à tous. Il y a eu
Hello, everyone.
251
There have been
338 cas de COVID-19 au Canada, dont 10 381 décès. À l'échelle nationale, il y a près de 33 000 cas actifs. Au cours de la dernière semaine, les laboratoires de tous les pays ont analysé quotidiennement les tests de dépistage de près de 61 000 personnes en moyenne, dont 4,7 ont reçu un résultat positif. En moyenne, plus de 3 350 cas ont été signalés quotidiennement au cours des 7 derniers jours. Le nombre de personnes souffrant des symptômes graves augmente également. Au cours des 7 derniers jours, il y avait en moyenne 1200 personnes atteintes de la COVID-19 qui étaient soignées dans les hôpitaux canadiens, dont 225 se trouvaient dans des unités de soins intensifs et de plus, 44 décès ont été signalés en moyenne chaque jour. Comme nous l'avons mentionné plus tôt cette semaine, nous sommes d'un optimisme prudent quant au fait que des vaccins sûrs et efficaces contre la COVID-19 seront disponibles au premier trimestre de 2021, ce qui nous rapprochera un peu plus de la gestion à grande échelle et à long terme de la COVID-19. Nous aimerions souligner que lorsque des vaccins seront disponibles, nous aurons d'abord des réserves limitées. Même si l'approvisionnement augmentera au fil du temps, les gouvernements fédéraux, provinciaux et territoriaux auront d'importantes décisions à prendre quant à la façon d'utiliser la réserve initiale de vaccins. Le Comité consultatif national de l'immunisation, ou le CCNI, est un groupe consultatif de longue date qui est composé d'experts et qui propose des lignes directrices et des recommandations indépendantes pour éclairer des décisions difficiles comme celle-là. Mardi, le CCNI a présenté ses orientations préliminaires sur les principales populations qui devraient être prises en compte pour l'immunisation initiale contre la COVID-19. Parmi ces populations, mentionnons les personnes qui présentent un risque élevé de complications graves ou ceux et celles qui sont fortement susceptibles de transmettre le virus à ces personnes, les travailleurs essentiels au maintien de l'intervention à la COVID-19 et les personnes qui contribuent au maintien d'autres services essentiels au fonctionnement de la société et les personnes avec un risque élevé d'infection et des conséquences disproportionnées du fait de leurs conditions de vie ou de travail, notamment dans les communautés autochtones. Le document d'orientation complet peut être consulté sur le site canada.ca. Bien que ces orientations préliminaires soient utiles en fin de planification, il reste encore beaucoup à faire. Nous devons continuer de procéder aux essais cliniques. Santé Canada doit approuver les vaccins s'ils sont jugés sûrs et efficaces et nous recevrons toujours d'autres conseils sur l'établissement des priorités selon les caractéristiques de chaque vaccin qui aura été approuvé. Entre-temps, il est primordial que nous continuions de suivre les multiples mesures de protection individuelles que nous savons efficaces pour maintenir le taux d'infection à un bas niveau. Restez à la maison, vous avez des symptômes, même faibles, lavez-vous souvent les mains, maintenez une distance physique, portez un masque lorsque vous passez du temps à l'intérieur avec des gens qui ne font pas partie de votre ménage et évitez les becs, les lieux bondés, les contacts étroits et les
and
espaces clos, ou
avoid
limiter le temps que vous
limit-
passez dans
or
de
limit
telles
time spent in
situations
the 3 Cs,
lorsqu'il est
closed
difficile de
spaces,
respecter
crowded
constamment
spaces, and
les
close
règles de
contact
distanciation
situations when you
physique.
can't consistently
Nous
maintain
demeurons
physical
résolus
distancing.
à tenir
We
les
remain
Canadiens
committed
informés
to keeping
aussitôt
Canadians
que les
informed
nouveaux renseignements
and to
seront
sharing new
disponibles.
information as soon
Merci.
as it becomes available. Thank you.
Thank you, Doctor. We'll now turn to the phone for questions. One question, one follow-up. Operator?
Thank you. Merci. If you have a question, please press star one on your device's keypad. Si vous avez des questions, veuillez s'il vous plaît appuyer sur les touches étoile 1 de votre appareil. Première question, Lina Dib, La Presse canadienne. À vous.
First question
Oui,
from the Canadian
bonjour,
Press.
Monsieur Trudeau.
Hello,
Je ne
good
suis pas
morning.
sur place, donc je ne vous
Mr.
vois pas
Trudeau,
tous,
I'm not
mais
here, so I can't
mardi,
see you all there.
Dr Tam
But
et Dr
on
New ont
Tuesday,
donné une
Dr.
nouvelle
Tam and
directive,
Dr.
porter un
New
masque
gave
3
new
épaisseurs
guidance with
en
regard
tout
to
temps quand vous êtes à l'intérieur.
three-layer
Alors, j'aimerais
masks
savoir pourquoi
inside.
vous ne portez pas le masque
I'd
quand
like to
vous
know why
parlez, vous
you're
êtes
not
à
wearing a
l'intérieur,
mask
ce ne
when
sont
you're
pas des gens de
speaking.
votre ménage
You're
autour de vous.
inside.
Et j'aimerais savoir
And
si
I'd
vous
also like
considérez
to
que les
know if you
parlementaires
believe
devront
that
aussi suivre ces directives-là, donc
parliamentarians should
changer
also
les règles
follow
dans la
this
cité
guidance.
parlementaire, en
That is,
particulier dans
should
la
the
Chambre des
rules in the
communes,
parliamentary
et sinon,
precinct be changed,
pourquoi non?
particularly in the House of Commons, and if not,
Merci,
why not?
Lina. Nous savons que
Thank you, Lina.
les comportements que
We
nous
know
avons
that
tous et chacun
the
ont un
behavior
impact
that each and
sur
every one of us has
la
does
COVID-19
have an impact
et
on
de porter un masque
COVID-19.
à 3
Wearing
couches
a mask,
quand
a
on est à
three-layer
l'intérieur,
mask when
c'est
we're
bien important
inside
comme
is very
directive.
important
Je ne sais pas si vous avez remarqué,
in terms
mais
of
j'essaie de
guidance.
porter le
You
masque
may not have
même
noticed,
pendant la
but I
conférence de
try to
presse.
wear
Quand
the
je ne parle pas, je l'enlève
mask
pour
even
parler
in the press
clairement.
conference if I'm
Mais
not
effectivement,
speaking, but I
je
take it
vois
off so that
certains
I can
journalistes
speak
choisissent de
clearly.
garder le masque pendant qu'ils sont au
Some
micro.
journalists here
Pour
are
moi,
wearing the
l'importance
mask
de
when
pouvoir
they're at the mic.
suivre les
It's
directives
important
dans
to
chaque
follow
situation
the
dans laquelle on
guidance
est
in every situation in which
est
we find
important.
ourselves.
Donc, on va continuer de faire ce qu'on peut.
So we'll continue
Je
to do
pense
what
que
we
c'est
can.
une question qui se
I
pose
believe
sur les
that this
parlementaires
question can be
qui sont
asked
dans un
about
espace clos.
parliamentarians
Il
who are
va
in
falloir
a
qu'on
closed
regarde un petit peu
space.
la
We'll have to
ventilation
examine
au niveau de la Chambre
the
des communes, mais c'est quand
ventilation
même
at the
un
House of
très grand
Commons.
espace. Mais
It's
effectivement,
nonetheless
c'est
a
les genres de
very
réflexions que nous
big
devons tous
space,
avoir
but these are
quand
exactly
on
the
entre
types
dans
of
un
questions
espace
that we
clos,
should be
quand on ne peut
asking
pas garder
ourselves.
2
When we
mètres de
enter a closed
distance,
space,
certainement. Faut garder un masque. Mais même maintenant,
we should be keeping
si
the 2
on
meters distancing
peut être à
and
2 mètres de distance, mais
keeping
on est dans un
a
endroit clos
mask.
qui n'a pas de très bonne ventilation,
If
ce
there's
serait
not
important de quand même
proper
porter le masque.
ventilation, it would
Je
be
sais que
important
c'est
to wear a
des
mask.
directives de plus.
I
Je
know
sais que c'est
that
compliqué pour les gens,
these are additional
mais c'est important de faire
instructions. I
tout ce
know
qu'on
it's
peut
complicated
pour
for people, but it's important to do
empêcher
everything we can
les
to
éclosions
prevent
de COVID-19.
outbreaks. COVID-19 outbreaks.
Ah, bon, alors,
Sorry. I think it's important for all of us to try and follow the best public health advice possible. I have, over recent days, taken to trying to wear a mask anytime I'm inside, including when I'm more than 2 meters distance from people, when I'm not actually speaking. This is an extra degree of protection, but it's an extra onerous step that many of us are going to have to take on. But we all need to do what we can to slow and stop the spread of COVID-19. Obviously, everyone's situation is different, the contexts are different, but using our best judgment and making those little sacrifices so that we don't continue to see mounting losses and increased disruptions from spread of COVID-19. We've seen many of our allies in Europe have to go into severe lockdowns, impose curfews. We've been able to avoid that in Canada so far, right across the country during the second wave, because in general we have been acting quickly and because the federal government has been there to provide support to individuals and businesses that allow public health authorities to go ahead and act quickly to prevent further spreads.
Une suivi, Lina?
Oui, merci. Donc, je ne comprends quand même pas la
Follow-up
logique
question.
d'enlever le masque
I
pour
don't
parler, parce que
understand,
depuis le début,
the
Dr. Tam nous
logic of
explique
removing
que
your
c'est
mask
quand
to
on parle,
speak.
qu'on
Since
chante,
the very beginning,
qu'on
Dr.
crie,
Tam
qu'on
has
est
said that
le
it's
plus
when we speak, when
à
we're
même de
singing,
transmettre
when we're yelling, that
l'infection
we're more
si on est
likely
malade. Alors, je ne comprends pas pourquoi
transmit
vous enlevez le
the
masque
infection
pour
if we're
parler.
sick.
Peut-être que Dr. Tam
So
peut
I don't understand
expliquer
why
la
you're
logique
removing your
scientifique
mask to speak.
derrière la
Perhaps
chose, parce
Dr.
qu'elle fait
Tam can
elle aussi
explain
la
the
même chose
logic
que vous.
behind
Je suis
this.
content de passer pour
I'll be
les
happy
conseils conseil expert à
let
Dr. Tam
Dr. Tam provide expert
ou à Dr.
advice,
New.
or Dr. New.
Oui, c'est bon, je sais, Dr. New. C'est sûr
Answer,
que
Dr.
si
New.
on
This is
chante
Dr.
ou
New.
parle dans un
Of
espace
course, if
clos
you're
avec
speaking
peut-être
or
pas
singing
avec
in a
une bonne
closed
ventilation
space,
pour
then there's
une
not
période de
proper
longue durée,
ventilation
ça augmente
for a
le risque.
long
Mais
period,
je
there
pense
is an
qu'aussi, il faut
increase
être un
in
peu
risk.
pratique parce que
But I
si,
think we need to
comme
be
le Premier ministre
practical
a
as well.
constaté,
As the
on
Prime
veut aussi
Minister has
communiquer comme
stated,
clairement.
we
Donc,
want to
d'après moi, si c'est
be
seulement
able to
15 minutes
communicate
dans un
clearly.
point de presse,
These are a
peut-être
few
pour
minutes
répondre
in a
aux
press
questions,
conference just to be able to answer
on
questions
utilise le micro,
when using the
ça peut aller pour
microphone. I
répondre aux
think that's
questions sans un
fine
masque. Mais ce qu'on
to
voit,
be able to answer
nous
questions
autres,
without a
si
mask.
c'est seulement quelqu'un d'autre qui parle, moi, je porte le masque
But if
aussi.
someone else is
Je
speaking,
pense
then
que
we wear
ce
our
n'est pas seulement
masks.
le port de masque qui c'est
It's
important,
not
c'est
just wearing
très
a mask
important
that
de
it's
souligner
important.
toutes les
It's
mesures.
very
On a déjà
important to
constaté
underscore
plusieurs fois
that all the
pour chaque personne
instructions are necessary
à faire
for every
bonne hygiène des mains,
single person.
distanciation
Good
physique.
hand
Le
washing,
port de masque, c'est
physical
sûrement une autre,
distancing.
comme on dit, couche
Wearing a
de
mask
protection
is another layer of
supplémentaire
protection
dans l'ensemble de toutes les mesures
in,
de santé publique. Et c'est
among
aussi,
all
je
these
pense que
public
c'est
health measures.
quelque chose, une
And I think
habitude,
it's
un
something,
comportement
it's a
que
habit
tout le monde
that
doit
everyone
doit apprendre comme une habitude
should
normale. Si
adopt
en hiver, si on sort de la
as
maison, c'est
a
normal, on porte
regular
une
habit.
tuque, des
As soon
gants.
as you leave the
Peut-être que
house, of
maintenant,
course,
si
in
on
the
rentre
winter,
à
you're wearing
l'intérieur,
a
j'espère que ça va être une habitude
mittens.
normale de porter un
Now,
masque
when
si
you
on
go
rentre
inside, you
dans
should
un
be
espace
thinking
public
that
ou
you should be
si on
wearing a
rentre, mais
mask.
même dans
If
une
you're in a
maison
public
privée,
space or
mais
even
pas
in a
avec
private home
toutes les mêmes personnes qui
where the
habitent sur le
people
même
in that
toit.
home are not
Donc,
part
je
of
pense
your
que c'est quelque chose, peut-être on peut répondre
family
dans
bubble
plus
or
de
home
détails
bubble.
après le Premier ministre est parti.
Merci. Prochaine question. Operator.
Thank you. Merci. Prochaine question, Émilie Bergeron, agence QMI. À vous.
Next question, Emily Bergeron, QMI Agency.
Oui, bonjour. Ma question pour M. Trudeau.
Yes, my question is for Mr. Trudeau.
Craignez-vous le genre de propos qu'on a entendu hier de M. Trump
The comments
qui
that we heard yesterday from
crie à la
Mr.
fraude
Trump,
électorale
he's
en
talking
se
about
basant
election
sur aucun
fraud
fait? Craignez-vous que ce
without
soit
any
dangereux
basis,
pour la
any facts. Do
démocratie
you
et que
think these
ça
comments are
incite au
dangerous for
dérapage et
democracy?
peut-être même
Do
à
you
la
think
violence?
that this is
Les États-Unis
he's inciting
gèrent
people
bien
to
leurs
be
élections
violent?
depuis des
Answer.
décennies et des
The
siècles.
U.S. has been managing
Nous
its
avons
elections
confiance
very
dans
well
le peuple
for
américain et
decades and
dans
even
leurs
centuries. We
institutions
have
pour
faith
bien
in
faire
the American
dérouler les
people and
élections.
the
C'est
American
normal que dans des
institutions to have
situations serrées,
elections
ça prenne un peu de
take
temps pour
place
compter les résultats. C'est
properly.
prévu
It takes
dans les
time to
processus
count the
américains.
results. This is something
De
that's
notre bord
foreseen
au
in the
Canada,
American
ma
process.
priorité,
On
c'est
our
toujours
side, in
d'assurer
Canada, my
qu'on est là pour
priority is to
défendre les
always
intérêts
ensure that we're
immédiats
here
et
to
long
defend
terme
the
des
immediate
Canadiens
interests
et on va
and
toujours le
long-term
faire.
interests of Canadians, and we will always do so.
Une suivi. Emily.
Et je veux entendre,
Follow-up
je veux
question.
entendre, oui,
I'd
sur
like to hear
l'amendement proposé par le Bloc
about the
québécois au
amendment
projet de loi
proposed
C9.
by
Donc,
the
ce qu'ils veulent,
Bloc
c'est
québécois.
essentiellement que
The
la
Bloc
subvention
québécois wants
salariale
the Canada wage
soit désormais
subsidy
formellement interdite aux
to
partis
be
politiques.
prohibited
Bon, le
to
Parti libéral,
political
comme le
parties.
Parti
The
conservateur,
Liberal
a
Party
arrêté
and the
de
Conservative
toucher la
Party
subvention salariale. Donc, êtes-vous en faveur de cet amendement?
have stopped receiving it. Are
Pendant
you in
la
favor of this
pandémie,
amendment
dans la
then?
première vague,
Answer.
on a été
During
là
the
pour
first wave of the
appuyer
pandemic,
les
we were
entreprises,
here
les
to support
organismes,
businesses,
les gens qui avaient
organizations,
perdu leurs revenus
and
à cause de
people
la
who had lost their
COVID-19.
income
Maintenant,
because of
on est en
COVID-19.
train de
Now,
relancer l'économie à bien des
we
niveaux et on a des
are
mesures plus ciblées.
relaunching the economy,
Alors,
restarting the economy
les
with targeted
mêmes
measures.
opérations, les mêmes appuis ne sont pas
The
aussi
same supports are
nécessaires
not
dans
as
cette deuxième vague.
necessary
Nous
during
sommes
the
en train de
second
regarder
wave, and
l'amendement
we are
proposé.
examining
Nous allons prendre une
the
décision avant de
Bloc
voter.
Québec amendment, and we'll make a decision.
Merci. Prochaine question.
Next question.
Operator.
Thank you. Merci. Next question, Corey Seegers, CBC Edmonton. Line open.
Hi, thank you. Dr. Tam, as we're in the second wave and we're seeing numbers rise in different areas of the country, and different provinces are implementing different public health measures, is there ever a point where Health Canada would consider stepping in and issuing national public health measures or recommendations?
I think our role has been to provide guidance, and I think we recognize that it's the provinces and territories that implement guidance. So, and they are taking into account their local epidemiology and their particular capacities and circumstances. So that's how it actually works. Obviously, if there's some extraordinary need, there are different tools that the government, in fact, the prime ministers and others can take. But really, we've already flattened the wave once. We know actually much more about what we can do about the virus. So I think the making sure Canadians are brought along the whole continuum of working together with public health and governments to deal with the resurgence. I think that's the most effective and appropriate way of managing. So, and we didn't want, as public health officers with the other chief medical officers, to get that balance so that we don't blanket cover the country with the same public health measures, but try to use a more targeted approach. And that's still currently the approach, but it needs everybody to work with that. So if the balance is tilted and the public health system is overwhelmed, then some of these more restrictive measures are coming in. So it is really important, but we would like everybody to help so that we don't have to do any broad public health measures.
And a follow-up, Corey?
No, thank you.
Okay, thank you. We'll turn to the room for questions.
Good morning. Prime Minister, notwithstanding, sorry, Tonda McCharles with the Toronto Star, notwithstanding your comments in French on the election, I'd like to hear you comment on the preliminary findings by the Organization for Security and Cooperation in Europe, the OSCE, did an international elections observer preliminary report on what's going on in the U.S. And they basically condemn the conduct of some of the practices there and saying, baseless allegations of systemic deficiencies, notably by the incumbent president, including on election night, harm public trust in democratic institutions. Do you agree or not agree with that report? What's Canada's position?
I'm not going to comment on a preliminary report. I'm also not going to comment on an electoral process that is unfolding in the United States as we speak. My focus is on ensuring that we are there to protect Canadian interests, to stand up for Canadian values, and we will continue to do that.
Juliane Lapointe de Radio-Canada. Donald Trump a établi, lui, qu'il ne fait pas confiance au système électoral américain. Alors vous, dites-nous, est-ce que vous faites confiance à l'intégrité du système électoral aux États-Unis?
Nous voyons les processus électoraux se dérouler aux États-Unis comme ils le font à chaque 4 ans, à chaque 2 ans, à vrai dire. Je sais que les gens sont impatients de voir les résultats, mais nous, on a confiance que les processus aux États-Unis sont en train de se dérouler de la bonne façon. Évidemment, nous allons continuer de regarder attentivement ce qui se passe, mais on ne va pas commenter à ce moment-ci.
In the States, but I don't want to comment
Obviously, we are watching, as everyone is, the processes in the United States unfold as their electoral process is underway. We will continue to have confidence in the American institutions that have managed their electoral processes over many decades and indeed centuries. But we will continue to be alert so we can ensure we're protecting Canadian interests and Canadian values in regards to our closest trading partner and nearest neighbor.
Hi, Prime Minister Tom Perry with CBC. I know you're talking about the electoral system working down in the United States. What do you need to see before Canada congratulates whoever wins this election? I know that there doesn't have to be a concession by the losing candidate. So what do you need to see before you say, this person's the winner, congratulations?
Well, I think it is extremely important in electoral processes around the world that they be able to unfold in an appropriate way without foreign interventions or interference with the elections. We always think about the concern about hostile actors interfering or intervening in electoral processes, but even friends can have an influence on public discourse around internal processes that are key to defending democratic institutions, and that's why we're going to remain very cautious about making any pronouncements in regards to the electoral processes in the United States until the outcome is sufficiently clear. Je pense que c'est important que des processus
Answer
électoraux à
repeated in
l'intérieur
I
des
think
différentes
it's
démocraties
important that
puissent se
the
dérouler en
electoral
bonne et due
process in
forme,
various
sans
democracies can
interférence ou
unfold
intervention
appropriately
par
without
des pays étrangers.
foreign intervention
Évidemment,
or
nous pouvons tous
interference.
comprendre que
Obviously, we can all
des
understand
acteurs
that
qui veulent troubler ou
there may be
déranger
hostile
ou
actors
influencer
who wish to
négativement
intervene or
la
negatively
démocratie dans d'autres
influence
pays
democracy
ne
in
devraient
foreign
pas
countries.
agir,
They should
mais
not be allowed
même
to
des
act.
amis et des
But
alliés qui
even
se
friends
prononcent trop
and
rapidement
allies
pourraient influencer le
may
déroulement
want
ou
to
la perception
influence
de déroulement
or
intègre à l'intérieur d'un pays. C'est
electoral
pour ça que nous
process
allons
or
être
the
très,
perception of the electoral process.
on
And
va
we
faire
need to be
très
very
vigilants, on va
careful.
faire attention
We'll be very
avant de se prononcer sur les résultats des
vigilant
processus
before
internes
or be
américains.
very prudent before commenting the election
Prime Minister Kevin
results.
Gallagher, CTV News. Premier Doug Ford has said that he's considering legislation to prevent companies like Whole Foods from prohibiting employees from wearing poppies in the workplace. Would you consider something similar on a federal level?
I think Whole Foods has made a silly mistake that I am hoping they will correct very quickly. Our Minister of Veterans Affairs, Lawrence McCauley, has engaged directly with them to highlight that they made a mistake and they should change course. This is something we see every year almost. Some company, some organization, some retail store makes a mistake around support for the legions or the wearing of the poppies, and it is quickly corrected due to public outcry. I think that is certainly what I hope will happen in the coming days. Je pense que on sait tous que l'organisation Whole Foods a fait une erreur en interdisant le port du coquelicot. Je m'attends à ce que cette compagnie change de cap très rapidement. D'ailleurs, le ministre McCauley des anciens combattants est en train de leur interpeller directement pour souligner l'erreur qu'ils sont en train de faire. Mais on voit ça quasiment à chaque année qu'une compagnie, un magasin, une organisation amène des règles qui limitent nos anciens combattants ou le port du coquelicot et rapidement, ils renversent leurs décisions et j'espère que c'est ce qui va se passer très prochainement par rapport à Whole Foods.
Very soon with Whole Foods.
Prime Minister Stephanie Levitz from the Canadian Press. Excuse me. There are now about 450,000 people in the country who've been out of work for 6 months or more. And we know the longer they stay out of work, the longer they're going to remain out of work. And for young people especially, it's a longer hit on their longer term earnings. So people would like to know, besides infrastructure spending, when will they see jobs? What is your government going to do to provide those jobs, and how fast are they coming?
I think one of the most important things that any society can do, any country can do when you're hit with a pandemic like this is be there to support people. And that's what we did from the very beginning. When the first wave hit, we were there to replace lost income with the Canada Emergency Response Benefit. We were there to support businesses large and small with the wage subsidy, with the CEBA business account, with the various measures on rent supports. We have been there for Canadians and we will continue to, because many, many Canadians have lost their jobs because of COVID-19 and are continuing to struggle. We made a commitment in the throne speech that we were going to create 1 million jobs going forward to get Canadians back to work. And we're looking at the investments we need to make in order to do that. But at the same time, we've seen from examples, for example, in other countries like in the United Kingdom, where trying to restart the economy too quickly, trying to get people back to normal in an accelerated fashion before we have completely controlled COVID-19, has left them in a worse position. They've now had to do a full nationwide lockdown and brought in extra measures that have really set back that economic recovery. We're not going to do that. We are going to stay focused on supporting people as long as we need to, as long as they need us to, through this pandemic, so that when we come out of it, we're going to be able to get things back to normal quickly, have our economy come roaring back, and be there to build back better. But we can't do that until we get through this pandemic, which is why it's so important for people to continue to follow public health advice and know that your federal government is there to have your back, to support you, whatever it takes, as long as it takes, until we get through this pandemic.
David Aiken, Global News. Good morning, everybody. I think I heard Dr. Tam this morning earlier say, this is a question for the Prime Minister, speaking about vaccine distribution, that federal and provincial governments may have to get involved. And I'd like to hear your thoughts about the federal government is procuring vaccines. Will it distribute it to provinces on a per capita basis, on a needs basis? Who makes those decisions? Will Parliament get a chance to weigh in? Will the premiers? Can you tell us a little bit about how the vaccine triage is going to work?
Obviously, obtaining vaccines for Canadians is a top priority for this government. From the very beginning, we put forward a vaccine task force, which is constituted of professionals and scientists who are weighing in on many of these particularly delicate decisions about which vaccines to pursue for Canadians, which distribution manners are going to be best, which populations need to be vaccinated first in the beginning when we have limited supplies of vaccines. All those decisions will be based on the recommendations of experts. The federal government has moved forward on procuring access to a large suite of different potential vaccines from around the world, different types of vaccines, different origins of vaccines, because we know that making sure we're maximizing the chances of having the right vaccine for Canadians is what Canadians expect. And indeed, we have one of the best potential vaccine portfolios of any of our peer countries right now. And we're doing that at the same time as we recognize that we don't get beyond this in Canada unless the world also gets beyond this, which is why we're part of the COVAX facility that ensures that there are supplies for vaccines for the developing world, even as we're securing supply for ourselves. The decision on how to roll out vaccines will be discussed by the vaccine committee of experts, but also it'll be a conversation with the provinces. We know that some of the first vaccines to come out have extremely high degrees of logistical support necessary, things like freezers that can keep the vaccines down at minus 80 degrees Celsius, for example, which doesn't lend itself to mass distribution in pharmacies across the country, for example, but later vaccines that will be arriving will be able to do that. So we have to have a very sophisticated plan to be able to roll out vaccines the right way, the right vaccines in the right place to the right people. There are many, many conversations to be had about who gets those first doses of vaccines, the most vulnerable, Indigenous peoples, frontline health workers. These are the kinds of populations we're looking at for their high degree of vulnerability. But of course, those are conversations that will be had amongst provinces and territories and including experts. L'approche sur les vaccins dès le début a été d'une importance primordiale pour ce gouvernement. On sait qu'on ne passe pas à travers cette pandémie sans avoir de vaccins ou de traitements responsables et on s'attend à ce que les vaccins commencent à arriver dans les mois à venir. Donc, devons nous préparer. D'abord, c'est le gouvernement fédéral qui va acheter et payer pour ces vaccins. On a pu conclure des ententes avec un grand nombre de différentes compagnies qui sont en recherche et production d'un éventuel vaccin. Et en même temps, on s'est assuré que quand on obtient des vaccins ici au Canada, on est aussi en train d'appuyer des vaccins qui vont être distribués dans le monde en voie de développement parce qu'on sait qu'on ne peut pas en finir avec cette pandémie au Canada sans aussi la terminer partout dans le monde. Par rapport aux décisions sur quels vaccins vont aller où et dans quelle séquence, il faut comprendre que les vaccins sont différents. Il y en a parmi les premiers qui vont arriver qui exigent, par exemple, qu'ils soient réfrigérés à moins 80 degrés Celsius. Ça va exiger une manutention, une chaîne d'approvisionnement et logistique particulier et nous allons on travaille avec les provinces
We'll be
sur
working with the
leur
provinces
capacité, leur
on their
ouverture
capacity
à pouvoir amener ces besoins, cet équipement nécessaire,
to
tout en
obtain
regardant quelles
this
seront les
equipment, the
populations que
necessary
nous
equipment.
devons
Now, who will
vacciner
be
en
the
priorité.
populations
On
that will
pense par
be
exemple
vaccinated
aux
first?
gens les plus
The
vulnérables,
most
aux peuples
vulnerable
autochtones,
populations, indigenous peoples,
aux premiers répondants et nos
frontline
travailleurs de notre système de
responders,
santé.
healthcare
Parce que
workers.
si on arrive à créer des vaccins et à
If
donner des
we
vaccins aux plus
come up
vulnérables,
with
ça
vaccines
va
and give them to the most
pouvoir changer le
vulnerable,
comportement même de
that
ceux
will
qui n'ont
allow us
pas
to
eu de
change
vaccin
and
dans cette
modify the behavior
première
of
lancée de vaccination.
people who don't
Mais
receive
on
the
sait
first
que de plus en
vaccines.
plus de vaccins vont arriver
We know,
au
however,
fil des semaines et des
that
mois et nous allons
vaccines
pouvoir
will come
agir pour
over
bien
weeks and
s'assurer
months,
que
and we
tous les
need to be
Canadiens
able
sont
to
protégés.
react to ensure
Il y a
that all
énormément de
Canadians are
réflexions
protected.
par
There's a lot of
notre
thought going into this
comité aviseur composé
on the
d'experts sur
part
la
of our
vaccination
vaccine
qui
task
sont en
force
train
made
de
up
nous
of
donner des
experts.
conseils scientifiques
They are providing
et médicaux
scientific and
pour
medical advice
avoir
to ensure
la meilleure approche. Mais on va
that our
continuer de
approach is the
travailler
best one. We'll
avec nos
continue to
alliés à
work with
travers
our
le monde et
allies
nos
around the
partenaires pour
world
assurer
and our
qu'on fait tout ce
partners
qu'on
to
peut
ensure that
pour en
we're doing
finir avec cette
everything we
pandémie
can
le
to
plus
put an
rapidement
end to
possible.
this pandemic as soon as
Thank you. That's all
possible.
the time the Prime Minister has this morning. The ministers and doctors will stick around for further questions.
I just want to say that I am only here for another 10 minutes. Dr. New will continue to answer those questions. Thank you.
Can I start? Just a question for Dr. Tam. This is to you because I think earlier this week there was new advice on masks that a 3-ply mask may be now more preferable. Some might call it, and that the middle ply may be best to be a filter material, polypropylene possibly. Some of my colleagues have been talking to manufacturers of polypropylene cloth, and they say that unless it's medical grade, they would really not advise their customers to be putting everyday polypropylene cloth close to your face. You're going to get a lot of chemicals. I wonder if you could speak specifically to polypropylene as one of the plies in a 3-ply mask.
Yes, so given the resurgence in cases and people all going indoors, I think recommendation of adding another layer of protection is important at this time. So we actually did some research at the National Microbiology Lab on the external 2 layers, if you like, the cotton, because it's actually really impressive because the virus doesn't really survive on cotton for very long. So that was important to us. That's a bit different from maybe some of the other international guidance as well. The filter layer, there's different types of things that are easily accessible in everyday life that people could use. The polypropylene has to be unwoven polypropylene, so it's the simplest access to them is the sort of interfacing that people use to when you're sewing or making garments. So that's been the advice. I'm not the expert in this area. That based on consultations and looking at the evidence, that's the kind of polypropylene. But it is important to get some precision as well. And so I think that's the unwoven aspect of it is important because that's how you trap the particle, basically. And based on the technical team at the agency, that interfacing material is easily accessible and is safe to use.
Dr. Tam, Tonda McCharles, Toronto Star. We've literally been asking you since March about aerosol transmission. The nurses have been asking since March, but this week you quietly changed the guidance, no big announcement. I'd like to understand what resistance you faced within your own circles to making that announcement and taking the precautionary step months ago of advancing the idea of aerosol transmission and the need to take more precautions. Why was that all just landed quietly this week?
If you were at my press briefing, I talked about aerosols on Tuesday. But we've been talking about aerosols, Dr. New and I, for quite some time. You know, the range of droplets, some of them are small, some of them are bigger. And I believe it was around June, we made a big push for the message on the 3 Cs, the closed, crowded environments where there's, you know, people, that's the context for some of the epidemiologic evidence on the bigger clusters, or some people call super spreading events. So that's the so what of do aerosols make a contribute is really about avoiding the 3 Cs. That was really important, and adding layers of protection like wearing a mask. Physical distancing still matters. Just because you're wearing a mask, you still have to, as much as possible, physical distance and avoid these 3 Cs. So we've been out with that message, you know, quite consistently for some time. So the international discourse on the role of different sized droplets has been ongoing for some time. So that's important. But I do think, in general, there is in recognition that droplets of different sizes will play a role. How much or how important a role is played by the smaller size droplets or the aerosols still remains an area of research. But there are circumstances, such as in a, you know, some of those outbreaks in the choir setting, in a particular workplace in Asia, in gyms, you know, those kind of areas where people are shouting or talking loudly in an enclosed environment with poor ventilation. So really, the advice hasn't really changed, but because we're getting into the fall and winter season, we can't go outdoors because that's where aerosols get diluted, or open windows as easily. It's important to look at what more we can do. So, you know, we've been engaging other scientists, more multidisciplinary scientists, including people who are more engineers and, you know, HVAC specialists and others, to look at, well, you know, should there be advice for people to make sure the HVAC system works appropriately? What other advice can we give, you know, the general public? So we've provided some advice in terms of, you know, increasing the mix of outside air for your home as much as possible using your system. And we will be continuing to discuss with experts in this area. Many countries have been discussing these things, and you know, the question is what additional measures people can take. Adding the mask is an extra layers is just more extra layers of protection. I think that's prudent at this time, given the cases are going up, and it's winter, and it's, you know, people have to go inside. So a lot of, but it's true that in the scientific domain, not everybody agrees all the time. That's just science, that's normal. And the evidence is epidemiologic as well as some laboratory, you know, engineering kind of sciences. So taking all of that into account and the context that we're in at the moment, it's important to really re-emphasize the 3 Cs and the HVAC area. Now, in terms of the health workers, we had a couple of exchanges, I think even in the last while with you personally, and the agency's guidance is very permissive in terms of personal point of care risk assessments. And I really strongly believe healthcare workers have to be given the equipment that they need to protect themselves. So because they all work in slightly different environments, they need to be able to make those point of care risk assessments. And if they needed a respirator, or if they needed a procedural mask, that has to be done at that point in time. So, but we will, honestly, we will continue to engage different disciplines and, you know, have another look at whether further measures are needed. So, you know, I certainly go into this not by myself. There's a lot of different scientists, and some of them may express different perspectives, but I do think we can come to consensus on a number of these things. So, yeah, so I think in the context of COVID-19, and people are just seeing out these discourse playing out in real time, essentially. But we're just trying to offer some sensible advice as we're going into the fall resurgence.
And what sensible advice then you have to workplaces in terms of investment in ventilation and what they need to consider before they bring workforces back into their workplaces. I mean, there are many buildings, new and old, where you can't open windows. What are you saying to employers around the country facing consideration of how they actually can safely reopen and use their workforce again?
Well, I think many workplaces have reopened and followed guidance, including physical distancing, wearing a mask, hand washing, all of those things, and physical, environmental, administrative procedures so that people can reduce the risk. So, the advice on different types of ventilation is something that we have to look at. We provided some preliminary suggestions for everyone, which is to get your HVAC system reviewed, serviced. But there are other, standards I think people need to look at and engaging standard-setting organizations. But, this is an evolving area of, I think, guidance, and we'll just keep continuing to do that. But, in the meantime, really make sure things are surfaced. And even in the winter period, intermittently opening a window if you can also help. But it's an area that we will continue to work at, because it's not an area that is the expertise of public health. So we're engaging, other sectors.
Thank you. Dr. Tam has to now leave, but the doctor and ministers will still be here, and we'll go to the phone for one question and then back to the room. Operator.
Thank you. Merci. Prochaine question, l'inaudible, la presse canadienne. À vous.
Oui, bonjour. Puisque Dr. Tam est parti, ce sera à vous, Dr. New. C'est pour revenir sur les aérosols. Écoutez, on en est rendu à voir des gens essayer de deviner ce que vous essayez de dire quand mardi, vous avez dit on oublie le 2 mètres. C'est important d'avoir un masque à 3 épaisseurs en tout temps à l'intérieur, puis que vous ne faites pas le lien direct avec l'infection par aérosol. Alors, pourriez-vous, s'il vous plaît, nous dire ça de la façon la plus claire et scientifique possible, ce lien que vous faites entre l'infection par aérosol et la nécessité de se protéger à l'intérieur en tout temps, même si on est à plus de 2 mètres?
OK, merci pour la question. Oui, c'est pas facile, mais peut-être que je peux répéter. C'est intéressant parce que j'ai même, je pense, au mois de juillet, j'ai élaboré un peu plus sur comme l'état de la science, les données probantes aussi, comme l'évidence, on peut dire. Et j'ai utilisé, comme on dit, je ne sais pas en français, c'est une analogie de fumée d'une cigarette. On dit que, on sait que le virus, c'est ça transmis par les gouttelettes. Il y a toute une gamme de gouttelettes. Les grosses gouttelettes, c'est sûr que ça tombe vite par terre si quelqu'un chante ou crie. Mais aussi, des autres petites gouttelettes, peut-être plus petites, qui peuvent peut-être rester dans l'environnement, peut-être pour quelques minutes, même peut-être quelques heures. Et j'utilise l'analogie de quelqu'un qui fume. Si on est à côté de quelqu'un qui fume à l'extérieur, c'est sûr que le plume de fumée, ça disparaît plus vite que peut-être la même situation avec 2 personnes, un qui est fumeur à l'intérieur, peut-être dans une bar, dans un restaurant. Donc, c'est quelque chose, il faut faire attention. C'est pourquoi Dr. Tam et moi, depuis plusieurs mois, on dit qu'il faut vraiment éviter en anglais les 3 C. En français, j'utilise l'acronyme BEC, il faut éviter les BEC, les lieux bondés, le contact étroit et l'espace clos. Parce que ça se comprend, le concept que oui, il y a peut-être des autres gouttelettes comme les aérosols qui peuvent être une source de transmission. C'est sûr aussi avec les sciences que on ne sait pas exactement c'est quoi la proportion des moyens différents. Est-ce que c'est
We don't
Je
know
sais
the
pas combien de
proportion
pourcents
of
pour les
cases
gouttelettes
that are
très grands
transmitted
ou
by
c'est
the different
combien de,
methods, by
on peut, comme il dit,
droplets or
dire
aerosols,
c'est dû à des gouttelettes plus petites, mais je pense que
by
les choses
different
importantes,
size droplets.
c'est quoi les aspects pratiques?
Additionally,
Les
so that's why we
les
have
aspects
to
pratiques, on a
be very
déjà
practical
vu
in our
notre
approach.
expérience au printemps au
Given
Canada,
our
quand tout le monde
experience,
était très conscient en utilisant les bonnes mesures de pratique, des mesures de
following
santé
proper
publique à
public
l'échelle
health
individuelle.
measures,
On a appliqué la courbe,
individually,
la distanciation
we were
physique,
able to
limiter le nombre
flatten
de
the curve.
contacts, le bon lavage des mains,
It's through
le
hand
port de
washing,
masque.
limited
So,
physical
c'est le même
contact,
principe aujourd'hui. Et
and
chose qui est un peu
hand
inquiétant,
washing
c'est
that
vraiment
we do
inquiétant
so.
pour les autorités de santé publique. J'ai déjà dit aussi plusieurs fois,
I've said,
au printemps, quand
I
les
said several
autorités de
times,
santé
rather,
publique
in the spring,
ont trouvé les cas de COVID-19, quand on a fait le suivi des
that
contacts,
when public health
en général, les personnes, les cas disent, ah oui,
followed
j'ai eu comme
contracts,
pendant
that
les
is, did
2
contract
semaines
tracing,
antécédents, peut-être 3, 4, 5 contacts. Maintenant,
that
quand
in the
les
spring
autorités
there
de
were perhaps
santé
3
publique
or
trouvent les
4
cas de la COVID-19,
cases
il y a
that
une
followed
vingtaine,
from
trentaine,
a
quarantaine de contacts.
that
Ça
followed
risque
through
de déborder
this
le
contact.
système de santé
Today,
publique pour
we're
faire
talking
leur
about
travail
30 or
de
40
suivi des
cases.
contacts et aussi on
So
commence à
public
voir
health
aussi les
is doing
conséquences
contact tracing.
dans les
We're starting
hôpitaux.
to see
Donc,
the
je pense qu'en
consequences
fin de compte, ce n'est pas
in
vraiment une question
hospitals now.
aérosol par aérosol.
So
C'est quoi
I'm not
les
sure it's
aspects
just a
pratiques?
question
C'est
of
quoi le comportement
aerosols
que
or
tout le
no
monde, tous les
aerosols.
Canadiens et
What
Canadiens
is the behavior
doivent,
that all
comment dire,
Canadians must adopt
utiliser comme des habitudes quotidiennes?
as day-to-day
Est-ce que
habits
c'est
to
clair?
protect themselves? Does that answer your question?
Thank you. We'll now return to the room.
Oui, bonjour, Juliane Lapointe de Radio-Canada. Peut-être une question pour les
Radio
ministres.
Canada,
Monsieur
I have a
Leblanc,
question
notamment, on ne vous a
for
pas
Minister
entendu aujourd'hui, mais
Leblanc. We haven't heard you
peut-être nous
speak
dire,
yet
on apprend que la
today.
sécurité des élus pourrait être
With
renforcée à
regard
l'extérieur du
to,
Parlement. Pouvez-vous nous dire à quel point ce serait important de le faire et qu'est-ce que ça prend concrètement pour que les élus se sentent plus en sécurité à la suite des incidents qu'on a vus dans les derniers mois?
Je pense que tout le monde, les parlementaires comme les représentants des agences de sécurité ont été inquiets les dernières semaines avec certains incidents. On pense par exemple à ce qui est arrivé à M. Singh juste devant le Parlement. Moi, comme parlementaire, comme collègue, j'étais évidemment assez inquiet quand on a vu ces images-là. J'imagine que c'est partagé par tous les parlementaires. Alors, le gouvernement, en tout moment, la GRC, évidemment, a une responsabilité en dehors de la colline du Parlement. La GRC est toujours en train de reviser leurs procédures, de faire des analyses de menaces possibles et de s'assurer la sécurité des parlementaires, des élus, y compris évidemment des parlementaires des partis d'opposition.
Parliamentarians are safe, including parliamentarians from the opposition party.
Avez-vous quelque chose à rajouter?
Follow-up question.
La même réponse pour moi aussi, M. Leblanc. Il a parlé avec monsieur.
I'll echo what Mr. Leblanc
Désolé, j'ai
said.
oublié.
Sorry, I forgot to take off
Monsieur
my
Leblanc,
mask.
il a parlé avec M.
Mr.
Singh et
Leblanc
l'autre
spoke
chef.
with Mr. Singh, the
Je
NDP
pense que c'est
party
nécessaire d'avoir
leader.
une stratégie pour
I think it's
protéger
important to have a strategy
les députés
that
et
protects the
aussi
safety
les
of
autres gens
parliamentarians,
dans la colline.
MPs,
C'est
and
une
other
stratégie
people on the
nécessaire,
Hill.
malheureusement.
This is a
Et
necessary
j'ai beaucoup,
strategy, unfortunately.
j'espère que nous pouvons trouver les solutions
I
bientôt.
hope that we'll be able to come up with the solutions for security issues.
Hi, Dr. New, Tom Parry with CBC. Dr. Tam was talking about her hope that there could be a vaccine in the first quarter of 2021. And I'm just wondering if you could elaborate on that. What's giving you that hope? And are you talking about one vaccine, more than one? Is there a candidate you see as the more promising?
Well, as Dr. Tam and I have been involved with obviously discussions with our colleagues in Health Canada to see how it's going in terms of, quote, the regulatory regime, because I think the first thing we want to stress is that whatever vaccines get approved in Canada, I think Canadians can rest assured that they will have passed the strictest sort of regulatory regime to make sure that they're both safe and effective. There are a number of candidates which are, as they say, farther along in the pipeline. And as the Prime Minister has also stated, the sort of the more promising ones, the early ones, which we anticipate because they're finishing off their their phase 3 trials right now, and certainly the experts will be looking at the evidence and so on. But if those get approved, They are more challenging from a logistical point of view. That one of the vaccines, as the Prime Minister stated, needs to be kept at a temperature of minus 80 Celsius. Certainly, that's not the way most vaccines in Canada in the past. In fact, none of them have ever been obligated to have that kind of cold chain, if you can call it, in terms of logistics. And so we have to obviously, working with our provinces and territories, work out the mechanics, in terms of buying the right kinds of freezers, et cetera, the transportation mechanisms, et cetera, to be able to assure that if that's the first one out of the pipeline that gets approved and be able to offer that to Canadians, that we're able to do that in a in the most effective and efficient manner. So there is, I think, as Dr. Tam and I stated in our opening remarks, we're optimistic, but certainly cautiously optimistic. And so besides the first couple, which might have some logistical challenges, I think that some of the other candidates, maybe a bit further behind, might be of what we call the more traditional type in terms of being maintained between 2 and 8 degrees Celsius. And those ones, certainly we can anticipate using the existing mechanisms for distribution within the provinces and territories.
How far along would we be then in terms of, with that one that needs to be kind of super chilled? How far along would we be in terms of acquiring the equipment we need to hold on to it and distribute that?
Oh, the work's actively going on. That you wouldn't believe what's happening behind the scenes. Certainly, lots of folks are working on it within the federal government, between federal departments, but also with their, I would say, their technical operational counterparts in the provinces and territories. I've been party. I've observed some of those discussions. Very technical in terms of, as the Prime Minister mentioned, we're looking at things such as syringes, how they're distributed, who's buying them, et cetera. I think one of the important things we want to state is that the Canadians can rest assured that the vaccines, whenever they become available, will certainly be free of charge for every Canadian who needs and wants it. Certainly, I think it's a choice we would anticipate most Canadians will make, not just for their own health, but also protect their loved ones and others. Certainly, I think the machinery behind the rollout of the vaccines is well underway. Certainly, we recognize there's lots of work ahead, but certainly at this point things are on track. Should we have a vaccine that's approved, I would say sometime early in the new year.
Stephanie Levitz, the Canadian Press. In October, you were reporting average daily testing numbers of between 70,000 and 77,000. But this week, that number fell below 61,000. And I'm wondering if you can explain why and what impact that may be having on the spread and containment of the virus.
Well, I think if you look at the testing numbers, I think the most important thing is that you need to be testing, quote, the right people, in the right place at the right time. I think we've said this over and again. And it's true that over the past few months, the testing capacity has increased across the country, and certainly I think we're at a point that the provinces and territories, I think, are in a good position, that they are able to, for the most part, I think, test, as they say, the right people with the right tests at the right time. I can't speak to actually what's happening on the ground. We certainly get data from the provinces and territories on a regular basis in terms of their testing numbers. What I think is important to understand is that I think in some provinces in the past few months, I think that there was maybe an approach, a strategy of offering testing to everyone, regardless if you were actually at risk or symptomatic and so on. And I think people are now recognizing that the best approach could or should be more focused, that it may not be the best use of resources, and it may actually sort of slow down the testing for those who actually need it. And so, as you can see, with the introduction of, I would say, more testing technologies, certainly we've put out guidance that shows that every testing technology that comes aboard needs to find its place in terms of an overall testing strategy. So, as we've said several times, the gold standard is still PCR. Most tests are still done where people get a swab done and then it goes to a laboratory. There might be a sort of a delay, so to speak, in terms of reporting a couple of days. What's now been introduced, and you've heard it obviously in the past few weeks, is that we now have more what we call a rapid turnaround test for the PCR technology. And that's great because certainly that's been a challenge in some of our northern, more remote, isolated communities. By having that test available for those who actually need to test because they're symptomatic, you want to get the diagnosis right. That PCR technology with a quicker turnaround time where you don't need to transport the samples to, quote, a laboratory down south is now available in the north. The newest sort of kid on the block in terms of testing technology, and this is the one that I think is under a lot of sort of discussion within the provinces and territories, is the antigen test, which we know is not as, say, maybe reliable or gives us accurate results as the PCR test, but certainly has its place. And so this is the point where in some settings where you might be doing more regular testing of asymptomatic individuals, people, let's say meat packing facilities where it's important to make sure that you're monitoring them on a regular basis, that has its place. But certainly if anyone were to test positive using an antigen test, we would then recommend that it's followed up by a confirmatory PCR test. So I think we can't get hung up about the numbers per se. It's all about the types of tests used, who's being tested, and so on. The one thing we're also looking at is what we call the sort of the positivity rate. That by itself, I think, is only one of multiple indicators, but that gives you an idea in terms of the degree of community transmission. So certainly at the international level, also in Canada, we look at jurisdictions. Look overall for Canada, we're at sort of 4.7% positivity rate. That's higher than it was in the summer. I think we'd like to get it lower. But certainly what we've seen is that in certain parts of the country, if you have a positivity rate over 10%, that's very concerning. And I think that's even been used as a sort of a criteria for indicating that a certain region in a certain province might be, quote, in a red zone.
I have one question for Minister LeBlanc. On the Board of Internal Economy's decision to hire, I guess, personal bodyguards or security force, some other kind of security force for MPs, I wanted to know, have you looked at the cost? What is the estimate of the cost of that provision, given that I gather it's not going to be RCMP, it would be something else? And have threats to MPs increased during pandemic?
So obviously, we don't discuss security measures or steps that are taken by professional security authorities to ensure the safety of people, for example, parliamentarians. The Board of Internal Economy is obviously on an ongoing basis looking at advice in terms of what can be done to ensure the safety of people who work on Parliament Hill, people who might visit, and obviously parliamentarians themselves. So those discussions are continuing. They have taken place for as long as I've been on the Board of Internal Economy. But the one thing the security professionals tell us over and over again is the most effective security measures are those that aren't discussed publicly.
Since the pandemic.
I'm sorry, Tana, can you repeat the question?
Just could you speak to, has there been an increase in threats or a reason for MPs to feel less secure?
Again,
en français aussi, s'il vous plaît.
Again, we think that members of Parliament should always feel secure in the discharge of their responsibilities. It would be unacceptable for members of Parliament to feel insecure when they're undertaking their important responsibilities. And the same thing would be true of people who work on Parliament Hill. So those discussions, those reviews are ongoing, and they're done by professionals with experience in how to mitigate any particular threat and what steps are appropriate to take. So in that sense, that work has been ongoing for a long time. En français, évidemment, la régie interne de la Chambre des communes, depuis des années que moi je siège sur la régie interne, a toujours été préoccupée par les questions de sécurité et qu'est-ce qui est nécessaire pour assurer la sécurité de tous les parlementaires, mais aussi des gens qui travaillent sur la colline parlementaire ou qui visitent la colline parlementaire, quoique les visites ont évidemment été énormément réduites depuis plusieurs mois. Mais la discussion avec les autorités professionnelles, y compris la GRC, a toujours été quelque chose que la régie interne et que les présidents des deux chambres
economy, and the speakers of the two houses, the House of Commons and the Senate, have taken very seriously. I'm confident of the measures already in place, and the security professionals have always told us that the security measures that are most effective are the ones that aren't discussed.
Thank you. The conference is now ended. Please disconnect your lines at this time, and we thank